So when a patient comes in through the emergency department, they are greeted by one or multiple ER staff members. They will be checked in by one of our patient access representatives. They'll just gather their name and date of birth. After they're entered into the computer, then they will sit with our triage nurse. This is an RN who has triage experience and is an experienced emergency room nurse. They will ask the patient questions that are pertinent to why they're here. So examples would be, what brings you in today? How long has this been going on? Are you allergic to any medications? Do you have a primary care physician in the area? After the triage is completed, the triage nurse will determine whether this patient can go to our faster care ER or fast track, or they need to go to the main emergency room. Based on why you're coming into the ER would dictate which area of the ER you go to. If you go to the fast track ER, it again is like an urgent care, but it's located within our ER for minor symptoms. So cuts, sore throat, minor runny nose, flu-like symptoms, you can go over to the fast track. Say you come in with abdominal pain, shortness of breath, difficulty speaking, you would go to the main ER, and there we have more resources to treat you. And once you're back in the room, you'll be greeted by the nurse that will be caring for you in the emergency room, and then also the emergency room physician. They'll examine you and order tests and treatments that are warranted for your symptoms. So you may get an x-ray done, you may get a CAT scan done, you may get some lab work done, and we'll explain all that to you to help you understand why those tests are necessary in determining what's going on. From there, we are running the tests and waiting for results to come back. And so once the results come back, we can determine whether or not you're going to be able to go home or if you need to be admitted to the hospital. If you're going to be admitted to the hospital, we would call the physician on call for your physician. They come in, they see you, they write admitting orders, and then we will get you upstairs to a bed.